The 4th annual UCSF Digital Health Awards seeks to find the most impactful and disruptive digital health companies. Out of the 1,000 plus submissions, only a select few have become quarter-finalists.
At Connie Health, we believe every senior should have access to high-quality healthcare, no matter their education, neighborhood, or socioeconomics. But social determinants of health drive health inequality. It's typically the wealthy and educated who have the greatest access to care. To level the playing field and ensure all seniors have great care, we built a one-stop shop for coverage and care that helps seniors access the quality healthcare they deserve. We've built proprietary tools for optimizing consumers' insurance coverage, which helps seniors afford the care they need, and tools for finding high-quality and Connie-vetted providers. Consumers can begin their Medicare plan search either online or by making an appointment with an advisor. Then they can meet a local advisor either on the phone or in person at the comfort of their home. Our local advisors are part of the community they serve. Because they are local, they are experts in their healthcare market and embedded in the social fabric of the community. Powered by our best-in-class technology, Connie Health advisors are uniquely positioned to help consumers throughout their Medicare plan journey, which could last 20 or more years. But we don't stop there. Our advisors and Connie Care team members provide consistent, continuous support post-enrollment and for our customers' entire Medicare journey, no matter what arises. Just one example, post-enrollment, our white glove concierge service supports our customers in finding the best doctors and understanding their plan to take advantage of its benefits. Our seniors have needed a company that helps them navigate their entire healthcare journey. Connie Health's end-to-end consumer-centered approach is our superpower. Our Medicare navigation platform, local advisors, and Connie Care team members increase senior access to high-quality coverage and care and advances health equity in the communities we serve. Thank you for your time and for considering Connie Health.
Wherever you are in your journey, whether you're tracking your cycle, starting a family, or navigating life as a parent, Ovia Health makes it easier to manage your goals. Ovia Fertility helps you plan your fertility with effective cycle tracking, whether you're trying to start a family or planning to wait. Ovia Pregnancy helps you have the healthiest, happiest pregnancy possible. Ovia Parenting supports you and your child through all of your major milestones and challenges. Get started by downloading the app that's right for you and tell us a little bit about yourself. Be sure to note that you have Ovia Health as a benefit and fill in the details. Now your health is always at your fingertips. Ovia Health provides personalized daily support based on your unique needs. Got a question? Talk to one of our health coaches at any time for expert advice and one-on-one guidance. This feature is unlimited and connects you to specialists from lactation and sleep consultants to registered nurses and certified nurse midwives. Get all this and more at no cost to you. Join Ovia Health today and download the app that's right for you to get started.
So how does Ovia work? Members will download Ovia to help them achieve their health and life goal, whether that is getting pregnant, having a healthier pregnancy, or simply understanding and navigating their new lives and identities as parents better. People trust us to understand and manage their conditions like PCOS or endometriosis. They trust us to help them conceive and realize their dreams of starting a family without medical intervention. They trust us to have a healthier pregnancy and realize their childbirth goals, to navigate the new lives and challenges of working parenthood, including that return to work process and navigating work-life balance. And they continue to trust Ovia on that journey as they navigate menopause and midlife throughout their entire lives. So what can we do? What can we as employers and plans and society do to prevent these gaps? We can embrace this notion of family-friendly and invest in women's and family care with digital solutions like Ovia that help people better understand their risks and intervene early so that they can manage their conditions better. We can break down the barriers to equal parenting by gender and these unrealistic ideals of being both this perfect professional and parent and having it all. We can equip people with digital solutions that help them understand their unique health and bring healthcare beyond the boundaries of the clinic and break down what are their barriers to care so that they can have a better outcome. Addressing these issues can not only help define a company's culture and help them attract and retain top talent, it can also save millions of dollars in healthcare spending every single year. Powered by both predictive analytics and nurtured by a care team, Ovia Health Solutions help people gain the control that they seek and deserve in their family's care, prevent costly outcomes and gaps in care, and unnecessary medical spending.
Redox is a service that connects systems together and allows them to communicate healthcare data back and forth. Who are these systems we're connecting? It can really be anyone. Hospitals, clinics, huge health systems, software startups that are in their first week of existence, software companies that have been around forever. It doesn't really matter as long as they have an agreement to start exchanging data. But here's the thing about all these systems. They all have a different way of storing and sending this data. There's no clear way of sending healthcare data from one place to another without rebuilding parts of your software every time you connect to a new system. Until now. You guessed it, Redox solves that problem. Redox will set up these connections for you and sit in the middle of the connection and provide a sort of translation service. The beauty of the Redox API is that it allows you to build your software once and connect to as many systems as you please. Because building with the Redox API puts the job of understanding all those minor differences between systems on us, on Redox, and it allows you to focus on your product.
The way patients access care has changed forever. The next normal in healthcare is online patient access, available 24/7, 365. Providing this digital front door is not only great for patients, but helps hospitals refocus on consumer-friendly engagement and revenue recovery initiatives. Enter Giant. Giant's AI virtual assistant is deployed on hospital websites and mobile apps. Patients can chat with the virtual assistant and get healthcare information, search for doctors, check symptoms, and schedule appointments based on industry-best triage protocols that route to your system's desired endpoints, including asynchronous care and telehealth. All from your health system's website, mobile app, and patient portal. Giant's AI provides a better patient experience, grows your customer base, and reduces call center traffic by up to 50%. Easily integrating into your EHR and customized to enhance your digital brand, Giant is up and running on your site in no time. Health systems who use Giant are thrilled with their results. In an independent survey, 100% of customers stated they would purchase Giant again.
Hi, I'm Justin Nelson, Chief Commercial Officer at Giant. What is Giant's superpower? In a word, accessibility. Today's health systems face a three-headed monster of 1, engaging with patients that disengaged during the pandemic, 2, dealing with staff shortages and an increasing volume of patients, and 3, coping with rising costs, inflation, the likes of which haven't been seen in 4 decades. Our mission at Giant is to make people better, and our superpower, accessibility, is to get patients in for the right care at the right time and at the right place. We do this by enabling patients to self-serve, growing confidence in their own ability to make health decisions, navigate care venues, and foster continuous engagement with the system. What differentiates us is that we believe text-based interactions are core to cost-effectively expanding accessibility. Why? Text is the great equalizer in conversations and transactions all over the world. Therefore, to support our mission of making people better via accessibility, we have built a solution to drive meaningful interactions between the health system and their patients. For meaningful engagement, we use a simple, text-based conversational AI that does 3 things differently. 1, Giant speaks in English and Spanish at a 5th grade reading level. 2, we are adherent in the latest web content accessibility guidelines, meaning Giant is easier for disabled and get users to engage with. And 3, our medical content and AI are actively managed by US doctors written for the US healthcare ecosystem and cover 1,000 of the most common conditions seen in US primary care. Why should we win? Providers and patients are adapting to a new healthcare landscape and a new economy. Despite these changes and hardship, we believe no one should put their healthcare needs aside. By meaningfully engaging health system patients, we are working to rebuild patients' access and confidence in the system so that we can continue together with our mission of increasing accessibility and making people better. Thank you.
Lexi was our way of closing the loop on hearing care provision by providing high-quality digital hearing aids at a fraction of the price with an all-inclusive service model that makes sure that you are never left in the lurch. So, service provision, that's my favorite part of the whole model because a hearing aid requires hand-holding and assistance, and we have a team of experts right next door that are on board to help you with just that. I spend so much of my time in interviews to find the right people for our contact center because 5-star service is at the heart of what Lexi does. Oh, by the way, I don't know if you noticed this, but while Lexi is an exceedingly powerful hearing aid, I doubt you even noticed I was wearing them. This is where the magic happens. This is our hearing hub, and they are waiting online right now to speak to you. Hey Nabila, I would love to know, what is your favorite part about working at Lexi?
I love being at the forefront of hearing care technologies and helping you hear the life you love.
Nabila is one of our hearing experts. Here at Lexi, we believe that hearing aids can change your life, your quality of life, the quality of the relationships in your life, and we cannot wait to be part of helping you hear the life you love again.
Pager works with health plans and health systems to engage patients with intuitive, consumer-focused technology. With our partners, Pager offers a single entry point to a complex healthcare ecosystem, empowering patients to access clinically appropriate care in the most convenient and cost-effective setting.
So we want to reach the consumer the way your preferred means of communication is. And we have you 24/7 access to a live nurse, a licensed clinician, a human being, just like my brother would do for me. And that person will listen to you, answer your questions, and then direct you to the right form of care. And then comes what we call the back end. This is the proverbial iceberg. Everyone thinks that Pager is just a mobile platform. That's what you see on the front. But on the bottom, beneath that iceberg, is this massive enterprise platform.
Integrating with all of the different disparate healthcare providers, payers, everything associated with the ecosystem.
Right. You're thinking about how fragmented the healthcare system is right now between pharmacy, radiology, primary care, specialists, urgent care. There's so many parts of the healthcare system that need to be tied together so that we have a connected care experience. The effective use case for AI and machine learning is to make our system more efficient. It's to automate things. And it's also to put quality control on things. So right now, our AI is learning. Every time we go through Q&A protocols when we talk to patients about what their conditions are, they see these repetitive pattern recognitions, right? Every time people are answering the same questions the same way, the result is the nurse is saying, I want to send you to telemedicine, okay? And in the future, once these protocols have a high degree of confidence, if that future nurse or doctor sends you to the wrong place, like ER, it's now quality control, and it can actually flag that situation so that the humans don't make the wrong decision.
Over 133 million people in US with chronic condition, and 60 million of them don't even know that they have it. 1.6 million people are diagnosed with cancer, nearly 600 dies from it, and the cost of cancer care is 174 billion in US. 11% of US population has diabetes, and 23% of them are undiagnosed. For colorectal cancer, 1 in 3 adults don't even get the lab testing that is required as part of the screening. So why am I throwing all of these stats out? Because lab testing plays a crucial role in preventative care. My name is Purya Sanai, and I'm the CEO and co-founder of IXLayer. And IXLayer is a platform and infrastructure that power lab testing and health testing in a remote environment, meeting the patients wherever they are. We combine 3 different layers: a technology layer, a connected ecosystem layer, and a digital experience layer. A platform that is integrated over 40 different services, from labs, mobile phlebotomy, physician network, kitting and fulfillment, insurance and eligibility, with a very Apple-esque patient experience, putting it patient in the center, enabling lab testing in a remote facility, and making it easy for our customers to launch diagnostic testing under their own brand to their end patient outside of a clinical setting. IXLayer was founded in 2017. We have completed millions of lab orders. We have powered 1,100 plus organizations and over 400 plus nationwide programs. We support diagnostic testing within population health, decentralized clinical trials, payers and gaps in care, chronic condition management, and even consumer lab testing. We're hoping with this platform to really change the industry, to bring lab testing to preventive care, and to try to reduce some of these stats that I started this video with. Thank you so much.
Now it's time to wear the Wave. So you want to wear it on the inside of the wrist. It doesn't matter which one, you can choose whichever one is more comfortable for you. And you want to be sure that you're wearing it on the inside of your wrist, not the outside. Now it's time to start feeling some waves. Depending on what you chose and the app setup, you'll be asked to try either cooling or warming first. I chose cooling, so we're doing cooling first. Like it says on the screen, we're going to press the dotted button twice. So once to wake it up and then once to start cooling. As soon as you do that, you'll notice the light in the center is turning blue, and you feel that cool immediately on your wrist. Now you might notice that the temperature you're feeling on your wrist is not steady, but it's coming and going in waves. So you feel a pulse of cool, and then it's off, then cool again, and then off. This is on purpose, and the rhythm of the waves is carefully engineered to optimize your comfort and relief.
Hi, I'm Dr. Pam Peek, Chief Medical Officer for Embr Labs, where I wear two hats. One is an NIH-trained clinical scientist and nationally recognized women's health expert, and the other is in business development as Senior Operating Advisor to private equity for 20 years. I'm here to tell you about a breakthrough technology where Embr Labs is creating a future in which people living for decades with crippling hot flashes can finally reclaim their quality of life. Who are these people? The 1.1 billion women globally undergoing menopause, as well as men undergoing prostate cancer treatment, resulting in the same devastating hot flashes. Our team of MIT-trained engineers developed our groundbreaking wearable technology to both track and intervene. How? A menopausal hot flash is an inside job where the brain's fight and flight response overactivates, resulting in a sensation of intense inner heat associated with drenching sweat, stress, and anxiety. Embr Labs' unique superpower is that we discovered how to use temperature sensations as a new pathway to the brain to regulate this inner fire. Our validated and patented dynamic thermal waveforms delivered by the device through the skin communicate with the nervous system and then the brain's temperature regulation centers. To achieve this, we actually leveraged the seminal work of UC San Francisco's Dr. David Julius, recent winner of the 2021 Nobel Prize in Medicine. We can even predict a menopausal hot flash 30 seconds before it starts to stop it in its track. This technology is so novel that there are no competitors. We empower men and women to take back control over their bodies and lives.
My Health Team is a company that creates social networks for very specific chronic condition populations. In 2012, I had no idea we would have a total of 40 social networks that would serve an addressable market of 90% of people living with chronic conditions.
I never knew that there could be such a community like this. Every time I go on the page and I see the little word new next to somebody's name, my heart breaks. But at the same time, I feel so glad that they made it there, because I know that they're going to get just swarmed with love and information and support, and it's going to get them through this absolute worst point of their life.
By bringing together other people living with the condition, by curating information from experts, from doctors in the field to the consumers in the form of quality information, people now feel less in a vacuum of misinformation and more supported.
Hi, I'm Jennifer Ernst, CEO of Tivic Health, and this is ClearUp, the first ever bioelectronic solution for management of sinus pain, sinus headaches, and sinus congestion. ClearUp is FDA approved with clinical data supporting it. Using no drugs, we are able, with a handheld neuromodulation unit, to deliver significant reduction in the common symptoms of sinus inflammation. ClearUp is used only on the outside of the sinus passages, and as users glide it, the unit indicates where to stop, delivering a very small pulsed electrical circuit through the skin and into the nerve fibers and the tissue and blood vessels of the sinus passages. In clinical studies, almost 90% of people saw significant reduction in congestion, as well as similar reduction in pain. And in fact, for many users, 3 out of 4 users experience relief within the first minutes of use. It's a 5-minute treatment, used 2 to 4 times per day. Portable, can be taken with you anywhere, used anytime, and there really is no limit to the number of times you can use it if you choose to during the course of the day. This makes it very different from pharmaceutical treatments that often have side effects associated with them, and certainly overuse would be a problem. So for a neuromodulation product, we are very excited that ClearUp is currently available on Amazon, Amazon Prime, Best Buy, Tivic Health. We have tens of thousands of users and hundreds of 4- and 5-star reviews. So ClearUp is clinically validated, tested by customers, loved by users, and we are very, very honored to have been selected for the award program this year. So let me take just a minute to show you how to use ClearUp. Now, for people like me, we do recommend taking off your glasses to make it easier to reach the different access points on the face. Start on the cheek, on the outer edge of the cheek, and glide towards the center. When the unit vibrates, hold it in place until it stops vibrating. Then glide to locate the next treatment point. Essentially, ClearUp is helping you locate the optimal treatment points for delivery of the therapeutic pulse. Now, as you go around, you'll go around the nose area, the cheek, and up the brow bone area. 2 to 4 minutes, 2 to 5 minutes per treatment. Start with going around each of the passages, each of the sinus areas, and then go back and treat those areas where you feel the most congestion or the most pain.
Hi, I'm Dr. Oliver Kras, CEO and founder of ZocDoc, and ZocDoc Superpower is our constant focus on putting patients first. ZocDoc's founding mission was to give power to the patient, and actually it remains our North Star today. Our online marketplace enables people to find in-network doctors, see their real-time availability, and instantly book appointments for both in-person and telehealth visits. We also accelerate access to care. The national wait time to see a primary care provider is about a month. But the typical appointment booked through ZocDoc takes place within 24 to 72 hours. We can offer the speed because we tap the hidden supply of care, the 20 to 30% of appointments that open up last minute because of cancellations, no-shows, and reschedules. And we're making those available to patients seeking care in real time. And by giving patients the ability to see and choose, ZocDoc gives them power. ZocDoc is different from others in the industry simply because we're the only company that delivers a comprehensive healthcare marketplace. So we help patients find and book in-network care for over 200 different specialties and more than 12,000 unique insurance plans. And patients can do all of this from a single platform. ZocDoc is the only company in healthcare to build and deploy this kind of marketplace at scale. We are bringing market force to the healthcare industry to make it work better. Lastly, ZocDoc is improving healthcare from the inside out to make the system work better for patients. That's evidenced by millions of people using ZocDoc each month to find in-network doctors, instantly book appointments, and so forth. And we're quite nimble. At the pandemic's outset, we allowed people to safely access care from home and help providers keep their digital doors open for business by quickly launching video visits and also a free HIPAA-compliant telehealth service for doctors. We also introduced and offered an efficient COVID-19 vaccine schedulers for patients in partnership with governments. One thing is certain, the healthcare landscape will continue to evolve, but our mission and innovation will remain.
Pack Health, we get it. Changing health behaviors is hard. Every person has unique circumstances, needs, and goals. And the more people you're trying to change, the more difficult change becomes. Behavior change scientist Albert Bandura said it best. Humans are producers of their life circumstances, not just products of them. So, how do we help a lot of people change their health behaviors while taking their unique that equips and empowers patients to take back control of their health? We help individuals improve their health outcomes, a driven approach. Pack Health members can expect their unique story to be an elemental component of their member journey person, not just their condition. Here's how it works. Members enroll in Pack Health and are matched with a personal health advisor. Members start by setting a large health goal, such as, I want to get my blood sugar under control, or I want to increase my weekly exercise. Health advisors work with members through weekly phone calls, texts, and emails to understand more about the member and help them break down their large goals into smaller goals. Pack Health has over 400 integrations that allow us to seamlessly provide resources that set members up for success. We're able to personalize engagement through wearable data, patient-reported outcomes, and more. Our members make real improvements in their physical, financial, and mental health in only 3 months. At Pack Health, we know it's possible to help each one of our members manage their health in a way that works best for them. And we can support your population too. With Pack Health, there's a better way to better health. Visit packhealth.com to learn how to get started.
What is Pack Health's superpower? I think I'd answer that 2 ways. Number one, it's our digital platform that allows our health coaches to do the great work that they do. And secondarily, the superpower is the relationships and the trust we establish with the people who we're coaching. The human-to-human interaction, I think, really allows us to provide the outcomes that we do. What are our differentiators? I may have answered this in what our superpowers are, but I think really our differentiator is 2 things. Number one, the relationship and the level of, I'll say, intimacy we develop with the people who we're coaching. And then the fact that we look at the whole person. We're looking at 30 chronic conditions plus behavioral health, which lays across all of this. And those 2 things combined, in addition to the trust that we build with people, allows us to help people make meaningful change in their own behaviors. And then they graduate from our programs and go back to their daily life, but it's a better daily life because they've learned how to better engage with their own healthcare. So why should Pack Health win the Digital Health Award? I think because digital health is one thing, but engaging an individual on their unique healthcare experience across multiple chronic conditions separates us from the competition. It's the fact that we look at the whole person, the fact that we're looking at the 30 chronic conditions, plus the fact that we include behavioral health, which really wraps around and weaves through many of the individuals who have chronic conditions in this country. And it gives us just a tremendous opportunity to really deliver outcomes. And I think at the end of the day, if you're gonna have any kind of interaction with an individual, there needs to be meaningful change from it. And I think that's what we deliver.
At OneDrop, we believe that healthcare should be proactive. It should prevent problems before they even start. We want to empower everyone to take action today so we can be healthy tomorrow. In order to do that, we must consider all the factors that make an individual unique, from family history to lifestyle choices to health data. We call this proactive approach Precision Health, and we believe it should be available to everyone. Powered by continuous health sensing and a wealth of data, OneDrop combines artificial intelligence, a behavior change program, and on-demand telehealth so that we can make better decisions for better outcomes, peak performance, and a more fulfilling life. We need to bring precision health to everyone, no matter where you live, how much you make, or where you are on your health journey. By making it easier for us to access our own health data and being empowered to act on it, we can help millions of people reach their full potential. Together, let's reimagine possible.
Join us on November 14th for our grand finale at Health in Las Vegas to see the winners crowned.